Some big news for Western Montana Mental Health Center in Missoula becoming the first certified community behavioral health clinic in Western Montana. And for more on what this means for the center and patients, we hear from Levi Anderson, CEO of Western Montana Mental Health Center.
Thank you, Laurel. As we're talking about today, the Western Montana Mental Health Center received a substantial grant from the National Substance Abuse and Mental Health Services Administration to transition our agency into a certified community behavioral health clinic. And what that means is that we'll be really better organizing how we coordinate care across all of our programs and services to the benefit of our communities and the clients that we serve. The Certified Community Behavioral Health Clinic model has been in existence for roughly 5 years. It was originally created by the National Council for Behavioral Health and was funded through a trial that was supported by the Substance Use and Mental Health Service Administration. So this trial had been rolled out in 8 states originally in 2016, and the results of the trial were so outstanding that SAMHSA and the National Council have been expanding this across the United States. For us here in Western Montana, we're excited to be a part of the first phase of CCBHC in the state.
So what happens during this first phase?
So really, the grant itself is designed to financially support our agency as we transition into an integrated model of care. And that's what that means is we will be organizing our services a little bit differently. We'll be adding some services to our organization, but primarily we'll be in a better position to provide care in the scope of whole person health. When a patient walks into one of our facilities, we want to make sure that we're addressing any need that they may have, regardless of whether that might be a mental health related issue or a substance use treatment need, in addition to potential comorbidities that may affect or compound the complexity of those issues. Okay. So we'll be looking at the whole client, the whole person, and working with them to coordinate care with and on their behalf to really treat them in a more effective way.
And you mentioned that patients walking into the clinics, things like that. I know that there's been a lot more telemedicine with the pandemic. How will you adapt to that with this?
So we have taken the opportunity throughout this last year to really enhance not only our ability internally to provide care through telemedicine, but also to assist our clients in accessing telemedicine. We work with many individuals who have significant mental health or substance use issues, and maybe they frequently need support in accessing telehealth. So while telehealth is fantastic, it's not a silver bullet, so to speak, to provide care in this environment. We still have to have the capacity and the ability to help individuals who need care in person. So we've undergone quite a bit of transition over the last year to make sure that we're in a place to do that.
And you mentioned that some new services might be added with this process. And what are some of those services?
So when we talk about the Certified Community Behavioral Health Clinic model of care, it is an integrated model of care, which means that we are combining the services that we currently offer with the ability to do basic primary care screening and identify underlying conditions that may be contributing to the acuity or severity of someone's mental health or substance use issues. So at that point, once we're in a position to identify those issues and conditions, we want to be able to make an appropriate referral to other providers who can assist with treating those conditions as well.
Okay. And then this 2-year grant's helping with the transition. How much is the grant for, and how is the transition going?
So we're 2 weeks into the transition. So we received the announcement 2 weeks ago. The grant itself became effective on Monday of this week. So we're very early on in the stages of this transition. But over the next 2 years, we'll be supported through just under $4 million of federal funding to help us transition into this model of care. to the benefit of not only our agency, but also to the benefit of the state and the clients we serve collectively. 2 additional agencies have been awarded this grant in other areas of the state. So we'll be collaborating and communicating with them throughout this process to ensure that this model of care is not just available in Western Montana, but that we're able to do it effectively across the state.
So does this by chance mean more jobs?
That is certainly a component of this. As we better coordinate services, as we transition into this model of care, we're absolutely going to need quality employees to help us provide the clinical services we currently provide, as well as those that we'll be adding. So this is not only, I mean, as of today, we probably have 40 or 50 job postings available, and we certainly love to interview any candidates that are interested in those positions. But then as we move further into this model of care, we will be adding additional employees.
And it really sounds like this model of care is just going to put the center really on the map here in Montana.
Absolutely. And not only is this a great opportunity for the Western Montana Mental Health Center, but this is really an exciting transition for the state. This model of care in other states, in the demonstration project states, has resulted in a new payment model that is more focused on value-based payments rather than what we have currently in Montana, which is a fee-for-service, primarily fee-for-service model. So as we progress through this, we'll be working with the state to identify an opportunity to transition into that value-based care model that we know produces excellent outcomes across the United States.
What do you like the most about this?
From my perspective, what I see is an opportunity for us and others who operate within this model to elevate the level of care that we're providing our clients. The idea of integrated and better coordinated care can really impact those individuals we're serving. So for me, that is a benefit in and of itself worth pursuing. So we're happy to have the financial support through this grant to be able to do that.
And make a comparison for the integrated care model compared to what's been offered.
So historically in Montana, we have operated on a fee-for-service model, which means that any individual service can be reimbursed within a set rate, whether it's a time-based rate or an occurrence-based rate. And really, as you transition more into value-based care, those interactions, the individual services become less important because we're looking at the whole patient and we're working to identify all of the issues that might be contributing to a patient's overall health and then coordinating care that can help address those issues.
All right.
So
Well, the center's going on.
Very much a change in how we approach the care we provide.
Yeah. Oh, it sounds like it's just a win-win situation for everyone involved, especially the patients.
I think so, yeah. And like I said, that's really the most exciting part for us, is because we know through the demonstration project across the United States that outcomes have improved as a result of this model. Cost has been reduced overall in various other areas that are affected by mental health and substance use disorders. So we have a lot to live up to with our model in the state.
Do you think this model will really become the dominant model that centers embrace across the U.S.?
I think so, especially given the results that we've seen from the demonstration project. I think the Certified Community Behavioral Health Clinic and the model of integrated care being provided through those clinics has demonstrated itself to be very effective, not only with the care that's being provided, but cost savings in other environments. Mm-hmm. So I very much see this as the future of integrated behavioral health care throughout the United States.
Wow. All right. Well, that's again, many congratulations on all of this happening. And is there anything else that you'd like to share with our listeners on what's happening at the center?
Well, only that we're excited to be able to keep you informed as we continue to make progress in this model. This is going to be a 2-year effort for us to transition and become more effective in this new model of care. So we'll look forward to keeping all the communities we serve apprised of our progress and build some excitement within those communities for the care that we're providing.
All right. And for those seeking care and all the new elements that the pandemic presents to a lot of patients and a lot of people trying to deal mentally with this pandemic, I know there are services there that they can take advantage of right now. Your recommendations for them?
Yeah, I would absolutely recommend visiting our website. We have the ability to register clients and schedule appointments through the website. With the use of telemedicine, we don't necessarily need individuals to present on site to receive treatment or have an appointment. So I would direct people to that resource.
Okay, so a lot of resources out there to help people get through this. And now that we have a vaccine that's out now, but there are complications with that and getting everybody vaccinated, have you been seeing anything new, any new trends that you're seeing?
No, and I think that's it's challenging because I think that there is generally a high expectation that now we have vaccines somewhat available. We have other ways that we would hope that our lives would improve and that COVID would go away. But really, that's not what we're seeing. We continue to see challenges related to the pandemic. We continue to see many clients who are experiencing prolonged ongoing stress because of conditions from the last year of living. Our daily lives in the world of mental health continues to see challenges related to the pandemic, and I honestly don't anticipate that that's going to go away in the next 6 months. I think we're going to continue to see an urgent need for mental health and substance use treatment services throughout our state.
And this model can really make a difference with this as well.
Yeah, I think so. One of the basic elements of this model is the concept of same-day care. So that's something that we're working on. Whereas historically, you may have had to make an appointment that would be scheduled out several weeks. Our goal moving forward as we implement this model is going to be to get clients in and help those individuals within the same day that they need help. That's a great component of this model is the idea that we needed to be in a position to help individuals when they need help, where they need help, and scheduling a client for 2 or 3 weeks from now isn't addressing the immediate need. So moving forward, as we make this transition, same-day access is going to be a big part of what we're looking for.
All right. And for those that might be seeking help right now, and also those that are looking for more information, just head over to your website.
Please do. Yeah, we're available and looking forward to helping anyone who might be in a position that needs it.
And I know there's some hotlines out there as well. The Montana Suicide Prevention Lifeline, 1-800-273-TALK. And the Montana Crisis Recovery Line, that's new. And that's 1-877-503-0833. All right. Anything else that you'd like to share?
No, only that I appreciate your time, and I'm looking forward to speaking with you again in the future as we make progress in the model.
Okay, we will talk again, and we're looking forward to that update. Thank you, and again, congratulations.
Thank you, Laurel. I appreciate it.